welcome back to another episode of Tech Pro Unicorn Podcast. Today we are going to talk healthcare technology, which is just everything that I'm about. It's everything that this podcast really should be about. And we're going to talk about a really cool technology and a really cool company that's helping do this virtually, right? So they're helping in healthcare. They're helping transform healthcare. They're doing it leveraging technology. And today I'm joined by Shuo Qiao, who is the co-founder of this company we're going to talk about. So if you want to follow along at home, the company is called Moving Analytics. It's at movinganalytics.com. And Shuo is the co-founder and CTO of Moving Analytics. It's a digital health company that reduces a large number of heart attacks through digital cardiovascular disease prevention programs. So we talked about a little bit of this in the past, right? How do we use AI? How do we bring technology into the home setting to better treat patients? And this is totally on point to that. They work with a multidisciplinary team of cardiologists, nurses, nutritionists, and exercise here's a tough word. And even though I'm in healthcare, right? Physiologists to create personalized rehab programs for heart attack patients, which they can access anywhere through their mobile phones. The programs help patients to manage their medication, exercise daily, create healthy habits like giving up smoking, while reporting their activities to their doctors and other caregivers. This is a whole other point that we've always talked about, right? Like, how do your doctors know what you're doing? So this technology also addresses that. This cuts by half the risk of a second heart attack, doubles the likelihood that a heart attack survivor will live for 5 years or more. Moving Analytics has raised $11.5 million for their digital health programs, developed in partnership with Stanford University. They serve over 1 million people annually. The company works with several high-profile partners, including the U.S. Department of Veteran Affairs, Kaiser Permanente, Mayo Clinic, Allegheny Health Network. Shuo grew up in China, earned his computer science degree from the Indian Institute of Technology in Madras, which we were just talking about before the show, which is very, very cool. The top engineering institute in India. He moved to the U.S. in 2013 for his master's degree in computer science, which he received from the University of Southern California. He's currently joining us from Los Angeles, where it is warm and wonderful, not quite as hot as Phoenix. Shuo, thank you for taking the time and joining us here on the podcast.
Thank you, Michael. Thanks for the invitation.
I love it. So everything that you're doing is like what we love to see, right? You're like, historical medicine has been, if you're a patient, you get in your car, regardless how sick you are, you travel to a physician or a provider. You sit in a waiting room, you wait a long time, you usually see them for 15 minutes. They give you a whole bunch of homework to do, and you go home, which is where you want it to be in the first place, right? And when we look at technology and the use of mobile technology, special mobile phones, I mean, you guys have developed something that just, serves the patient by keeping them at home, serves the physician by giving them the information from the patient, right? So you're helping them make this great, this treatment plan with them, and you're leveraging mobile technology. You're kind of like all in it to win it all together. So as a co-founder, how did you guys see this need come up? How did you see we have something here where we can really help?
This, home care, I think the demand is always there, but, a lot of people just struggling to go to the hospital or care center to get enough care. But, it was, restricted by the technology back then that, thing that they want to do cannot be achieved because there's no smartphone back then. There was no, good speed internet. There was no business model around that, things like that. And all factors that prevent that from happening. One good thing that make this happen is, back 7, 8 years ago, there's a boomer of smartphones, and the internet infrastructure also increased for the speed of stuff, and more and more people start thinking about the possibility of doing care at home, and just think about the efficiency of, you'll be able to talk directly to the doctor online instead of you had to make a phone call, schedule appointment, go in person. How much time is being saved, all stuff, and there's just tremendous advantage to do home care. And along with that, for us, we focus on home-based cardiac rehabilitation because we do see a need, for cardiac rehabilitation. And overall American, there's probably 18 million American every year are eligible for cardiac rehabilitation, but probably only 1/3 of them actually attend cardiac rehabilitation, which is like not a good number, to be honest, because cardiac rehabilitation are really important for patients actually, because it double their chance for live for 5 more years, and that's by done the research from the research result from American Heart Association. So it's super important to attend that, but only 1/3 of them attend. What's the reason? Because it's far away. They have to go 3 times a week for 12 straight weeks. It's far away and hard to schedule the time. Usually during the work hours of yours, you have to take PTO and drive probably 1 or 2 hours to go there. So it's super hard, And then it just came to us that why don't we build a home-based cardiac rehabilitation program, and so that they can do the rehabilitation at the comfort of their home at their own time. So that's how it come to our mind.
I love it, right?
Mm-hmm.
You bring up so many points that are valid when we look at continuing care in
Mm-hmm.
healthcare. A lot of people just don't follow through, right?
Mm-hmm.
They have an event, they get treatment, and usually whether it's physical therapy or continued cardiac care, right?
Mm-hmm.
People just, they don't do it. They have busy lives. They don't want to drive. They don't want to go there. Sometimes it's cost prohibitive, right?
Mm-hmm.
And we can drive, I really believe we can drive costs down in healthcare, provide better care and better outcomes with the use of technology, just like moving analytics, right? Where we can deploy mobile technologies that they already have, so the costs are relatively low, right? Usually the engagement through this is a lot higher. People prefer to be engaged on their phones or on their computers
Mm-hmm.
than the inconvenience of showing up at a physical location.
Yeah, of course. Just think about the traditional cardiac rehabilitation center way of doing things. Like as I said, there's already 1/3 of the patients, apply for go to a rehab center and they start the program. But just because it's such a long way to drive to there and such a hard time, hard thing to schedule the time like 3 times a week and like 12 weeks straight. I think the finish rate is probably half of that, which means half of the patient that apply for starting the cardiac rehabilitation center program, only half of them finish it. So I think so the retention rate is really not great. And with mobile care and home based care, the retention rate are much higher. And
Yeah.
patient just more willing to just use that approach because it's just so easy. Just open the smartphone, they are connected to the doctor. So
It's interesting, right? Because we saw, take the pandemic, right?
mm-hmm.
We saw everything shut down and healthcare essentially go almost 100% virtual, right?
Mm-hmm.
You saw your personal physicians, you saw the minute clinics, the urgent cares, almost the ER, right? Almost everything was virtual, unless you had COVID and then you were in a physical setting. If you had a serious enough case of COVID, right? But
Yeah.
healthcare totally went virtual and went to home care. And what's just boggling my mind right now is everyone's kind of going back, right? Like going back to the way it was. And I'm like, wait a minute, we just kind of proved that we can deliver healthcare via telemedicine and telehealth.
Hmm.
With high rates of success and accuracy and great outcomes. Um, what's your thought? I mean, to me, I believe telehealth and home health using technology is really the future, right? In the future, it's probably going to
Hmm.
be the majority of how health
Hmm.
is. But I want your thoughts on telehealth in the future.
I think that's a really great, question on that. And my thought on that is probably going forward, it's gonna be a combination for sure. It's just be in person visit plus, home care with mobile technology together. And the reason I'm saying that is, and also when do we choose in person versus home care? I think one of the factor is, what's the urgency or seriousness of the disease or conditions, and that's what actually mobile care probably also can shine, where the mobile care at home can help the patient to do the triaging, which is super important. As long as the triage is done, you ask the preliminary questions, and the doctor online or physician online, can just answer that question for you and suggest whether you just can do a home care, directly, or you should make appointment to do a in-person visit. Once the triage is done, I think you just follow the guidance, and some patients who need in-person care will go there, and most of them will stay at home and do the care. Yeah, I think but that will be the case.
Um, uh, you know, cardiac. If we think about these patients, after a cardiac event, or even leading up to one, right, whether they have blockages or other things, these people are fairly frail, right? They're compromised, I'd say. So it to me, right, just the services that you guys offer, the therapies, the treatments, again, that they can do in their home on a mobile device is it, it, it's 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 awesome. Talk to me about some of like the success stories, right? What's the feedback that you're getting from some of your the current customers that are using this?
I think what we are facing are two different parties. I think we are facing the care provider, and also I think the patients also using our product. I'll just use these two angles, both, I guess. From the
Yes.
patient, I think we already touch a lot. The love the product because not only make them life easier, where they can conveniently talk to their doctor, their care manager, tell them what's happening with them, what the condition was, ask for advice, and there are also guidance really needy for them on the mobile phone. They open it, they know what to do for the day and for next day, things like that. And they get training material, things like that. They can learn on the mobile. And that's amazing for them as an experience. They don't have to travel. It's easier for schedule time, all stuff, and that's just tremendous help. And on top of that, I think another thing they really like as part of the mobile program is, instead of just taking 2 hour a week or 3 hour 3 times a week, things like kind of visiting hour that's scheduled with care manager, they actually get care potentially like 24/7, which means they get longer time of coverage that they can actually text or talk to the doctor anytime they like. And of course, the doctor or the care manager may not reply them right away, but they will get them back ASAP instead of they have to schedule appointment and go. So the care also over, there's smart devices, they tracking their, vital signs, tracking their symptoms. So you get the continuously the data for you, so that the doctor can look at your data that for last 24 hours, last 7 days, last 14 days. And it's super helpful for the doctor also, to diagnose is your condition. So that's another huge improvement, like compared to the traditional rehab in the center where they get care 3 times a week and probably 1 hour each time, right? And now you have 24/7 throughout the week. So that's amazing feedback from our patient as well. And that's two things majorly feedback from our the patients customer that we had. And I think in terms of the hospitals, they are also really happy to use our product because as we also touched that a little bit at the beginning, where they actually struggle of they also know cardiac rehab really good for the patients, and all the patients should do it. But the problem is, patient have the dropout rate. They don't come to the rehab center. Even they make appointment, they don't show up. That really worry about the hospital because one of the measurement they have for their performance is the readmission rate for the hospital and the
Mhm.
insurance company. They really want to show good care by showing a really low readmission rate, so that they are struggling with that because patients don't attend cardiac rehab. Now they have us as their partner, and they're really happy to have us in the sense of we provide the care at home, and that increased the participation rate of the patients into cardiac rehabilitation program, and that helped them to reduce their readmission rate and make their metrics look much better. And also, I think for the hospital, they want to give the patient the best care, and that with home care as an extension of their hospital care, they show that proof to their patients, and so they are really happy on that side as well. And in terms of the economy cost, I think that's more relevant to the payer in the health system. That for the payer that work with us, they also struggle with the readmission rate, but but what matter for them is even more on the economic side, right? With the readmission rate keep being high, they have to pay a lot of other pocket for reimbursement. So they are
Right.
willing to pay some money for us so that we take care of their patients, so that the patient don't get remitted, so they don't have to pay the reimbursement for that part. So it's a huge economics save for the payer as well, in the sense of by working with us, they not only improve the care quality of the patient, also reduce the cost for them economically. So
Yeah. What's really cool, what you just explained, is what I think everybody wants to change in healthcare, right? When you talk about people and they talk about healthcare, they want the quality of healthcare to go up, right? Which it does because patients stay more engaged with this technology, right? They
Mhm.
want the cost of healthcare to go down, which
Mhm.
it does because the economics of leveraging technology in this case drive the cost significantly cheaper than an on-prem environment. Um, it's almost like this is a little microcosm of the, and granted, we're only in cardiac care here, but if we take this and look at other modalities and other treatment areas, right, this is a great example to me of we can transform healthcare, right? And it's hard sometimes we think about boiling the ocean and we think about all of healthcare and it's so big, but you guys really took one little piece of that and created a program that's highly effective, that drives costs down and improves outcomes. It's a win-win for the payer, the provider, and the patient. It's really kind of cool. Um, you have experience, right? Both growing up and exposure to China. You did your studies in India. When you look outside the U.S., are there technologies like this available in those countries? Are they as prevalent as what you guys are doing here? I mean, you guys co-founded a company, deployed it, grew it, are there others doing the same thing? Are you guys penetrating those other markets?
I think what's happening in China and India, I think the healthcare system are a little bit different compared to the US. And in China and India, I think a lot of people are doing out of pocket cash payment instead of insurance payment. And in China, there is a government insurance instead of private insurance company. In America, it's totally different. Like most of the patients using commercial private insurance companies. So yeah, the business model are different, and also the population density also different in India, China, and compared to the U.S. So those differences, I think, also not only those two differences, and there's another differences on what metrics are being focused in different country. I think in the U.S., I think because the U.S. has been doing healthcare industry for such a long time, it has been evolving for such a long time. It not only providing the care by itself, and also is shifting to something called a value-based care. Right, previously it's called you go to hospital, you get the care, hospital get reimbursed, patient get reimbursed, things like that. Right now it's more shift to care quality, basically. Instead of down surgery in the hospital, you get the reimbursement right away. The pair company want to see the patient get a care, get a portion of reimbursement. But if the patient don't get readmitted in 30 days or 90 days, then the hospital get another reimbursement. So that really drive that the hospital to want provide even better quality of care, right? And compared to in China and India, I think they're still on the phase of trying to cover the reimbursement for the care by itself as many of disease condition as possible. And they just start catching up on the care quality part, which is not widely adopted in the policy and the government reimbursement policy and the commercial policy. So that's a little bit different for condition in the US and in the India and China, that without the driver of the quality for care, it's gonna take some longer time to have this home-based care to propagate to become even more popular. But at the same time, as I said, in China and US, no, in China and India, a lot of patients are actually paying out of their pocket by cash. So that basically drive the possibility of just doing, one-off consultant on the mobile, and you pay for that consultant fee right away type of business model there. And it's already become super popular there, that patient get an app and they can ask for the domain expertise for each disease condition they want to ask online, and the question will be directed to the expert there, and they will answer that, and the patient is pay out of pocket for those answers. And it has been widely adopted and there. But what's lacking and need improvement there is the driver for care quality, that I'm talking about on the insurance company and government insurance company side. Of course, they already start doing that, but I think they need some couple of years, some more effort to make it more widely accepted, and so that it will potentially help the home care uh, company like us to have some opportunity there. Mm-hmm.
It's interesting, right? Because of the populations, right?
Mm-hmm.
When we get into these densely populated areas, it's just not possible for them to, have the opportunity to go physically to facilities, right? It would just be overwhelming.
Yeah.
Um,
And that's
to,
why
to,
it's
yeah,
yeah, that's why it's as I said, the right now the pay out of pocket that model is
yeah.
widely adopted in India and China, that even for rural area they don't have a good doctor there, they can ask doctor directly online. For doctor in the big cities like in Shanghai, in Beijing, they can reach out to them directly with the mobile phone and ask online. And now they have even because the India, I don't know of the infrastructure, but in China the infrastructure of internet are getting better and better, and they have 4G, 5G, even, like they can do really high quality video call and
Mhm.
here as well. So even in a remote village I'm talking about. Yeah. So
Yeah, it's so cool, right? I mean, we're a little spoiled here, I think, in the U.S. because if we want to, most insurance covers, telehealth of some sort. We can pull up our phones, pull up an app, log in, and usually we can talk to a physician within 10, 15 minutes.
Mhm.
Using telehealth.
Sure.
It's very cool. So you guys, potentially wind up being both a B2B and a B2C customer,
Right now we are more like
population and designing for that.
B2B. Yes. Hmm.
So as a CTO, right, a relatively young CTO, I might
All
say,
right.
right, you guys,
Things I.
yeah. So you guys built this, right? Anyone who knows that they enter any business into healthcare, right, that comes with lots of regulations and laws and HIPAA and high trust, and we got all these cool buzzwords that make you feel really safe. How do you design a product, right? That's a consumer kind of based product as a CTO. Like, how hard was that? What went into your thought process around that?
I think it's super hard. And it's harder than I thought because when we start, we are not. I mean, as you know, I'm like young and I don't have much experience at the time, and I'm surprised how hard it is and how complex it was. But it's good thing is we figure out along the way, and the way we did it, I think healthcare, which is a good thing in the sense of the companies and the government take patients' data privacy seriously, and even have the law and regulation there. I think it's a good thing that show respect and take good care of the patient data. And to achieve that, I think for our company, I think it's two level things that we are doing. First, we have really to teach ourselves what we need to achieve on the company level throughout every employee of the company. We provide the HIPAA training, security training, so that everyone in the company knows what data is supposed to be product data and what data are not like that sensitive. They can deal with regularly. They have to have the awareness to begin with for anything they do. Even not a developer, even it's other team, sales or other teams, they should know this. So I think it is a good thing that everyone is aware of this. So when
Great.
they do the things in the company or doing operation in the company or putting a program in the product, they are aware of those things and they are careful and they show respects. And that's the first thing we do, right? Do a company wide like HIPAA security training. The second thing is more like technical side. How do we achieve and meet the standard of the security regulation? What's good thing about is the government regulation usually have a good documentation on what need to be done on each different domain, and for each domain was the granular control need to control. I mean, things that need to be implemented. What's the different control need to be implemented, and they wrote it down in details and in requirements, and that's give us a good guidance that we just go through the list and make sure we check the box, and then we should be able to good to go on the basic minimum level in the sense of we meet the bar. And there are a couple of industry widely adopted standard. There's HIPAA compliance, there's SOC 2, there's high trust, and some are easier to achieve, some are harder to achieve. And we are glad we and high trust is probably one of the harder one. So we are really glad that just 2 months ago we just finally achieved high trust certificate, and that means we
Oh
are
wow!
compliant. So that's a big achievement for the company.
Congrats. Yeah,
Yes.
that's hard to get.
Yeah, it's hard to get.
That's
Hmm. Yeah. So
I mean,
mhm.
when you're doing all this, right, and you're kind of, I mean, because you're learning while you're designing, right, which is, I mean, you have all your technical knowledge, but you're like,
Mhm.
ooh, how do I solve for this requirement? How do I solve for that requirement?
Mhm.
Um, but it's not just a once and done, right? You guys are constantly. We always hear about all the cybersecurity attacks on. We have a client in healthcare, and they just got breached, right? And it's devastating, right? It brought all their systems down for several weeks. It made the papers. There's usually lots of fines and penalties attached to it. Um, I don't understand the sick people that choose to try to attack, um, you know, hospitals and people that are trying to do good in the community and provide care. But they do, right? There's those kind
Mhm.
of people that are malicious, the bad actors.
Mhm.
How, as a CTO, how vigilant do you have to be to try to constantly stay ahead of all these people?
I mean, I think what you said is totally right. And as a company, we keep checking what's new, what's the threat, things like that, and what's new technology that potentially help us to lift the pressure a little bit, and provide better security. That's why we actually have been changing our architecture for at least three times that I remember. In the sense of each time provide a better security feature, and better encryption, better policy, things like that. You just have to keep alerted what's new available on the market that potentially helps you to do that, and also what's the new threat that we have to to product against. And also another thing that you know uh, that we have to do is always do internal audit, in the sense, you have
Mm,
to have regular internal review. I think there are two parts that we do. First thing is we do an internal employee interview that asks them what do they do in like their work life, and then we identify where other potentially security risks are there that possible exposing data, things like that. Is there a risk of that? And then we'll, once we done the interview analysis with the risk, and then we'll do remediation for that. And second thing we do is more technical, that we have auditing every access, every, in terms of who, what time, what data they access, was this is success or fail, what's the result, how large is the request, how long it takes, things like that. All the detailed data on the granular level, we have log. We log everything, and once in a while, regularly we will, pull off the log, and we will do a review and see whether there's a risk, whether there's someone has a abnormal access pattern, or did someone try to log in like from with this try to log in like 1,000 times in like 1 minute, something like that. That's clearly attack, things like that. What's the things that we basically have to do the analysis as well. That those are the things that we do regularly.
to me, right, I've always said I'd love to be a CIO of a large healthcare provider.
Yeah.
And I've always said, and I never want to be the CTO, right?
Hmm.
Because the CIO is like the relationship guy, the vision guy. The CTO is like, hey, that's great, but now I got to figure out how to make it work, right?
Yeah. Hmm.
You're dealing with all the technology and all the tools that are available, and then bringing that all together to keep the data secure, the platform operational, everything that really matters, right, lands kind of on a CTO's shoulders.
Yeah.
Um, how involved are you in like the app's use and feel, right? Like the customer design, the customer experience. How much of that do you get? This is an app that's on a mobile phone in users' hands.
Hmm.
How close to that do you get to stay?
I think one good thing is, we get a really great help from our VPL product, which is Joe. He take a lot of that
Mhm.
into his hand, in the sense of helping us to make sure the user experience are good. Of course, all the co-founders and their key members all use help him to give him feedback, and so that he can design or have the vision on what's the best user experience for the patients. I think there's a couple of key things that we kept in the app that I think is really good, that we receive really good feedback from the patient. That one thing is I can remember, our app is super simple, like because the population that we deal with
Mhm.
usually is mid-age or probably older population, and they tends not so tech savvy. So we make our app as simple as possible. Our the size of our font, are really big as well, so that it's easier for them to read. And there are just a couple of single buttons, intuitive buttons for them to to click. And there's several simple pages, they know what they mean, things like that. So we want to keep that as the core of our design, in the sense of the usability, and and how easy to read, things like that. And along with that, we also have, we even like go one step further, that we know we are also dealing with a lot of minority language population.
Mm.
So we have not only the English version of the app, we also have Spanish support as well. So that's something that, of course, we're planning to add more language support as well, so that it just makes the life easier for our patients.
I love it, right? It just, the role of CTO to me is always, it just seems kind of just overwhelming, right? All the, because
Hmm.
you have to stay close to the product, you have to stay close to your own teams, right? You have to be involved in cybersecurity, and you're usually dealing with infrastructure and
Hmm.
architecture and
Hmm.
cloud, and um, you're just like, I just picture like CTOs sitting on a chair just kind of spinning in a circle, right? Because there's just so many things that a CTO is really involved in, right? Whether you're setting direction or setting policy,
Hmm.
or exploring, right, and listening to the product guys talk about like, hey, we need to do this, that, and the other,
Sure.
because they don't bring it to life, right? Sorry, product people. Product people are usually like vision people, or they might be, um, you know, setting like, these are the upgrades that we need. But it's really like the CTOs and the tech teams that then are challenged with bringing that to life, and making sure that it's secure, and making sure that it's fast and agile, and doesn't affect the customer experience. It's just kind of crazy, all the things that swirl around a CTO.
I think one key thing is, you have to find good team member and good colleagues to work with. I think I get great help internally with different colleagues, and they take good care of their things that they do, and that's really amazing, and just make my life easier, I guess, on that side.
Yeah. Does do you manage? Is your most of your team remote and virtual? And how is it like managing a team that's like that?
We were remote for a while, for during the pandemic, but ever since I think the new year, we start the policy that, because most of us are vaccinated or stuff, and we just follow the state COVID policy.
COVID.
Basically, they suggest us that, hey, I mean, as long as they are vaccinated, it should be fine. So we start ask our employee to move back to the office 3 times a week. It's still hybrid, but not every day they have to go, but 3 times a week. I think that combination is good, in the sense of fully remote. I think sometimes it's just like the connection when people discuss in face, that it has more efficiency. But like going to work in the office every day, I don't think that's good. I think that's also lot of overkill, because all the travel time and some other
Hmm.
things like that. And I think 2-3 times a week, that's a good balance between the efficiency and the happiness of the employees at the same time.
I love it. I
Hmm.
love it. Well, um, very cool. I love what your product does. I love the niche market that you serve. You're just a great example of what how we could um, transform healthcare, right? How we could leverage technology and really drive costs down, patient satisfaction up, engagement up, better outcomes, thanks to the data that's provided to the provider. It's just kind of a win-win all the way around. Have you guys thought about other places where maybe you could take this model that you guys have built and serve other segments of healthcare? It's kind of
That's
a leading, forward-thinking statement, so it's okay to dance around that.
definitely that's something in our roadmap. But at the same time, we definitely at the near future we definitely want to stay focused more on the heart diseases. Right now, we want to expand more heart diseases that we cover. Probably that's one thing that we try to cover right away is COPD. But along with heart disease that we cover, I think another thing that we can, I think, is similar or close that we can tackle is probably diabetes and obesity. That's something that we can start thinking about that. And along with those kind of domain expansion, I think also the geographically, expansion. And right now, we're trying to expand across the U.S. as well. That's just another thing that we're tackling in the near future.
Awesome. Well, it'll be fun to watch you guys. Thanks for sharing not only about moving analytics, but about your role as CTO. And it's always cool to see a young CTO, right? Just kind of getting an opportunity like this to co-found something, to grow it, for it to be successful. It's a really cool story. So thank you for taking the time and being on the podcast.
Thanks for your time, Michael. Really, really glad to be here.
Absolutely.